in terms of the source of pain, it's actually quite tricky. Not every, the pain does not come from the joint all the time or inside the joint. Of course, from inside the joint, the synovium, which is the joint membrane can be inflamed. So you can get pain from the synovium of the joint. Sometimes the pain actually comes from the bone because there's increased pressure in the bone, and sometimes there's small fractures in the bone, and that can cause pain. And then, of course, the bony swelling can also have inflammation, and sometimes this bony swelling can press on the nerve that will cause nerve pain. The joint capsule can also be distended, especially if there's more swelling, and that can be painful as well. And sometimes because it's distended too much, the joint becomes a bit wobbly and there's instability. And then muscles and ligaments can be strained with spasm, and therefore there can be pain. And of course, whenever a patient is emotionally anxious or depressed, they actually can feel more pain as well. So osteoarthritis is one of those chronic pain conditions where the mood can be badly affected, and the low mood can worsen the pain sensation. So here is just an example of how the pain in the knee may not be from the knee joint. Here, the doctor is feeling a bursa below the knee joint line. So it's actually not in the joint, but in a bursa next to the joint. And of course, there can be pain around the collateral ligaments, which is the ligaments by the side of the joint. There can be pain at the back because of hamstring strain. And sometimes the pain can be from the hip, referring to the knee. So therefore, whenever there's the knee pain, we need to examine the hip as well, because it could be a pain that's from the hip, but somehow the patient feel in the knee. That's because of the nervous innervation of the hip and knee being related. Yeah. Then, of course, the problem with osteoarthritis is that it's not easy to correlate the damage of the joint with the pain and then the disability, because a lot of times there's obvious changes in the x-ray, but not all of them feel pain. So clinical will be one small group where they feel pain, and only a smaller group will feel that they are disabled by this pain or by this deformity in the joints. So thankfully, not everyone with bad x-ray pictures of their knees or fingers have clinical pain and disability. But we therefore know that there are many other factors that contribute to what is the disability and the pain felt by the patient.